The Astral Perspective, a revolutionary approach to lowering blood pressure. Published on May 26, 2023 by Shaman Dao. I recently was referred to a client who had a blood pressure reading of 148/94, which is considered stage 2 hypertension. For a 25-year-old female, Jane, with a blood pressure reading of a 45-year-old CEO, something had to give. And if we didn't act quickly, it would have been her heart. In Eastern medicine and culture, we are taught how our emotions affect our physical bodies, as the psychological landscape of human emotions is vast and complex, thus intricately intertwined with our physical health. There's a fascinating aspect of our emotional health that we sometimes forget to consider, and that's how our bottled-up emotions can play a role in our overall health, contributing to conditions like high blood pressure, or as it's commonly called, hypertension. My objective was to assist Jane in harmonizing her internal discrepancies. By implementing a multifaceted healing strategy, we successfully reduced her blood pressure from stage 2 hypertension to stage 1, achieving a level of 138/82 without the use of medication, all within a span of a month. While my method of restoring imbalances within an individual often stems from an astral realm perspective, I hold no resistance towards medication. I understand that certain situations call for medical intervention, as it can provide crucial support, even if it isn't always required. In Jane's case, we went straight to the astral realm, which led me to some of her deeply embedded emotions. Jane was referred to me not because I am a doctor, which I am not, but because I am solution-driven and have gotten efficient healing results quicker and faster than the average traditional routes. Disclaimer: I never give medical advice, as this content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. It is not a substitute for a medical exam, nor does it replace the need for services provided by a medical professional. Always seek the advice of your medical professional before making any changes to your treatment. Any medical questions should be directed to your doctor. A quick Google search will give a list of successful reduction techniques that require a comprehensive approach, encompassing professional medical guidance, potential medication, dietary adjustments, weight management, regular physical activity, moderation in alcohol consumption, quitting smoking, and stress management. Yet, where is the acknowledgement and emphasis of an often overlooked element in successful blood pressure reduction: the management of suppressed and repressed emotions? In the recent issue of the Journal of Clinical Hypertension, A.J. Wilburn and his team delve into the usage of non-conventional methods such as vitamins, minerals, and botanical substances to manage hypertension. They particularly focus on those substances that have been documented to have a clinically significant impact on reducing blood pressure. A combination of the most effective strategies, including weight loss, sodium intake control, and moderate exercise, might relieve around 20% of hypertension patients from the necessity of medication. However, the majority of the population will still require drug therapy for blood pressure control. On a broader level, while non-drug interventions may benefit some patients, they cannot be considered a complete treatment strategy for most. In terms of natural remedies, there's an ongoing re-evaluation driven by increased consumer awareness about pharmaceutical advertisements. Natural products are often perceived as safer and preferred by many patients. Nevertheless, as pointed out by Wilburn et al., some of these substances may not be as harmless as one might think. They are often advertised as lifestyle enhancers and even potential replacements for medications, but some can be more harmful than existing antihypertensive drugs. Substances like garlic, L-arginine, vitamin C, and omega-3 fatty acids are frequently used and sometimes advertised for their potential benefits in reducing blood pressure. However, the evidence supporting these claims is often contradictory or inconclusive. While some studies suggest potential benefits, the lack of adequate control groups and comprehensive long-term studies makes it challenging to draw definitive conclusions. Again, no mention of pulling the cause from the roots of our stacked trauma parts to always treat the symptoms. Repressed emotions, those feelings we've consciously or unconsciously buried as a means of coping with their overwhelming intensity, can often serve as potent catalysts for persistent activation of the stress response. It is paramount to address these dormant emotions to alleviate the burden on our cardiovascular system. How was I able to guide my client to lower her blood pressure from stage 2 hypertension to stage 1 in 1 month without medication? Did it involve crucial lifestyle changes and medical intervention? Not necessarily. I guided her in 4 shamanic ceremonies to empty out her pot. Just like a full pot of any liquid can boil over with just enough heat under it, a person's overly stacked emotional body can affect the physical body until the pressure becomes unbearable. Ladled on top of the old can be new traumatic events that add to the stack, compounding the stress and potentially leading to more severe symptoms of trauma-related disorders, such as post-traumatic stress disorder, PTSD. It's also important to note that responses to trauma can vary significantly between individuals, depending on a variety of factors including their personal resilience, support network, and previous experiences. Is there a magic pill to all of this? The answer is no, because Jane's journey to better health was a mix of spiritual and physical efforts. She not only participated in transformative shamanic ceremonies, but also committed herself to regular gym workouts and improved her hydration habits. This comprehensive approach made a world of difference. Not only did her blood pressure drop from stage 1 to stage 2, but she also shed the 20 pounds she had been struggling to lose for years. We were able to shift perspective to many of the meanings she was conditioned to believe about her life and herself, therefore giving her the ability to let go gracefully and with ease by pouring my golden medicine in ceremonies. That's what happens when you address the root causes rather than just alleviating the obvious symptoms. You start to release those buried emotions and naturally become lighter from within. Will Jane's blood pressure continue to be managed with just 4 of these transformative shamanic ceremonies? The key lies in consistency. Provided Jane stays committed to her wellness journey, regularly touching base with me or another healthcare professional and keeping up her routine of physical activity, she should maintain her progress. But there were 2 things I prescribed to Jane in our last session besides the regular lifestyle modifications I'd love to share with you. Remember to feed joy to the little Jane inside every chance you get. Take 5 minutes to yourself to place your hand on your heart and tell it, thank you. For more information, please visit shamandao.com.